Are your eyes red, gritty, painful, and irritated? Well, this episode is for you. I'm going to talk about the management and treatment of dry eyes and what you can do. Millions of people around the world suffer from dry eye, and many use drops and are not finding relief. Stick to the end of this video and you'll know how to manage your dry eye. Let's get started. So dry eye symptom is when your eyes become dry because you don't produce enough tears or you don't produce quality tears. The tear film consists of 3 layers. There's a mucus layer, there's a water layer, and also a oil layer. These 3 layers act as a sealant for your eyes and it keeps it moisturized. When your eyes don't have enough tears, the surface of the eye will start to dry. And we see this as punctate epithelial erosions. And they literally look like little pits, little marks on the surface of your eye. This leads to pain, irritation, and vision loss. Typically, you try to use artificial tears and they help somewhat, but if you have severe dry eye, artificial tears may not be enough. Oh, my eye! There are many causes of dry eye. Some can be from medications that you're using, can be from autoimmune diseases, inflammation, and also just by the fact that your eyes aren't producing enough tears. Now, in the modern world, there are people using screens more often, and screen time is now associated with more severe dry eye because we're not blinking as much in front of a screen, and therefore we're not able to produce the tears needed to keep up with the dry eye that's associated with screen use. Let's explore some strategies to manage your dry eye. I recommend warm compresses. Now, don't just use a towel, because if you use a towel and stick it in the microwave, it gets warm initially, but then what happens is the evaporation makes the towel cool down. A little trick is that you can actually put it in a Ziploc bag after you heat up the towel, and the lack of evaporation will also keep the heat longer. So you can make hot compresses with a warm towel and Ziploc bag if you desire. Or you can get an eye mask that has these little beads at CVS, Walgreens, or I got mine at TJ Maxx for about $5. And these little beads will warm up when I stick it in the microwave, and then I can just put it on my eyes and use it to warm up my lids. So when I use the eye mask, when it's heated on my lids, it's actually heating up my lid, my bulbing glands. My bulbing glands are the oil glands of your lids, and that helps the oil to flow and secrete better from those glands. As you recall, the tear film has 3 layers. It has the mucus, it has the watery or aqueous layer, and then also the oil layer. So these warm compresses will help with the oil layer. I recommend using the warm compresses for 10 minutes at a time. And if you have really bad dry eye, use it 3 times a day. And if you don't have bad dry eye, maybe every day or every other day would be appropriate. After the 10 minutes of warm compresses, use a no tears baby shampoo solution that's diluted down with just tap water. And then using a Q-tip, dip that into the baby shampoo. And then what you want to do is you want to give yourself an eyelash shampoo. So what I tell patients is that we often wash our hair, except for me because I'm bald, but we often wash our hair, but we never wash our eyelashes. And so as a result, over time, there can be a lot of scurf and skin cells and dirt and even parasites called demodex that can live within the lashes. And those little critters, as well as the debris and the dandruff, will clog the oil glands. Okay, so the next thing you can do is using eye drops. So there are several eye drop brands that are available, and this one, there's 2 in one box. One of them is artificial tears. That's the blue. The red is get the red out. So the problem with getting the red out is that it's a vasoconstrictor. That's how it works. You put it in your eye, it constricts the blood vessels, and it makes your eyes white. However, when the medication wears off, it will dilate again, and when it dilates, the redness and the irritation will be worse. So I recommend using the Get the Red Out solution sparingly. Let's say you want to go on a date, or you're meeting somebody, or you have a business presentation, or you have a important engagement where you want your eyes to be white and not bloodshot and look tired. First, get some sleep. So that's the best thing to do, is get adequate sleep and your redness will actually be diminished. But if you have to get the red out and you want to use the drop to get the red out, use it sparingly, maybe once in a while. The other drop is the artificial tears solution. And the artificial tears will help lubricate the eye, help to moisturize the eye, and makes it feel better. Now, there are many brands of artificial tears. I recommend that you try the one in the bottle first. So there's Refresh, there's Genteel, there's all these different brands. And I'm not here to endorse any particular brand. However, if the artificial tears in the bottle irritates your eye, you will have to use a preservative-free artificial tears that comes in little individual vials. If you have tried warm compresses, lid scrubs, and artificial tears and still find no relief, ask your doctor for punctal plugs. Your doctors can place in plugs that will delay the drainage of the tears from your eyes. They often will do the trick. There are also prescription eye drops that can be used like cyclosporin, and that helps to reduce the inflammation of the eye and therefore help with dry eye. These medications are pretty expensive, so check if your insurance will cover them. Another available therapy is intense pulse light. IPL is a treatment where intense light is shot at the lids, and that opens up the meibomian glands and helping the oil flow. But keep in mind that you can also do that with the lid scrubs and the warm compresses and all the other treatments I mentioned earlier. But the IPL therapy is not completely covered by every insurance company. So there are insurance companies that will cover it, but most do not. So check with your insurance companies, because this can be several $100s to over $1,000 for treatment. The last treatment I'm going to talk about is autologous serum drops. This process takes the patient's blood, spins it down, and takes the clear part of the blood and makes that into an eye drop. That serum has a lot of nutritious and nourishing elements that will help dry eye patients, and they do work and it's effective. Check with your doctor if autologous serum is appropriate for you if you have severe dry eye syndrome. If you have found my video to be helpful, please like, share, and comment. Also, remember to subscribe so you don't miss any future videos. Until next time, I wish you a wonderful day. Thank you.